And it gives me great pleasure today to be talking about glycemic care practices among patients with type 2 diabetes across borders. And when I say across borders, I'm talking about across India, Bangladesh, and Pakistan. Our work was presented as the best poster in IDF 2021, and it gives me indeed pleasure to tell you that this work received a lot of critical, I would say, insight from Hasnain Sir himself. Some of my colleagues who participated in this work, their names are up over here, and I would want to use this opportunity to convey a heartfelt thank you to each and every one of them who have helped us understand our patients better. Conventionally, when you talk about Ramadan, we talk about Ramadan more from the science of fasting. We talk about Ramadan from the science of what medication can we use, what medication we cannot use, hypoglycemia, hyperglycemia, complications of diabetes, etc. But as far as the art of medicine is concerned, as far as our patient population is concerned, we thought, do we really understand it? Are we really aware about what our patients think? And to try to bridge this gap of knowledge, we decided to conduct this study to identify what awareness levels do our patients have, what practices do they believe in, and what is their experience actually before and during Ramadan. To do this, we conducted an online survey of a convenient sample of 3190 diabetic patients who attended 10 clinics from these 3 countries of ours from April 1st, 2021 to 31st May 2021. Mind you, this questionnaire was customized to use the language of communication, whichever it may be. For example, it was Urdu in Pakistan, it was Hindi in some parts of India, it was English, which was used in some of our clinics, and it was the Bangladeshi language, which was used in Bangladesh. Mainly, there were 30 questions which were addressed, a few of them which I will address over the next few slides due to the constraints of time. I may not be able to talk about all the questions, but there were 3 domains we were looking at. And these 3 domains were, what are the perceived gaps as far as current knowledge is concerned, behavior and glycemic care practices? What kind of information we possibly could have on socio-demographic characteristics? And what kind of participation do these patients have in the previous Ramadan? And what advice do they receive from the healthcare providers? We are increasingly talking about risk stratification. We are increasingly talking about pre-Ramadan education. But what we were trying to understand is that actually what do our patients perceive from all the education that is imparted to them? As I said, the data was collected in these different clinics and was analyzed using the GraphPad software. Some of the questions which we tried to understand were pertaining to, did the patients fast during Ramadan? Did they have a problem during fasting at previous Ramadan? Did they undergo any kind of pre-Ramadan checkup? Are they really going to do any kind of post-Ramadan checkup? And were they planning to fast, or are they fasting during Ramadan in 2021? Some of the other questions that we tried to address were, since how many years did the patients have diabetes? That is, what was the duration of diabetes? What kind of therapy were patients on? Did they have any comorbid conditions? And do they really believe, or are they aware of the fact that in Ramadan, when you fast, there's an increased risk of hypoglycemia, which has been one of the most pertinent questions that we have been trying to answer at all points of time. Dehydration, we belong to tropical countries. Do patients believe that dehydration is more common during the month of Ramadan, especially since Ramadan has been coming in the hot months in the last few years? Do they believe that fasting actually helps control their type 2 diabetes better? And to add to it, do they believe that specifically Ramadan helps them control their blood glucose much better, or it does not? Another question which we try to understand is that, do patients who take medication believe that they could not fast, or do they believe that they can fast the whole month of Ramadan? Finger pricking, another very big issue as far as monitoring during Ramadan is concerned, and still an area which requires more education, because a number of our patients still believe that finger pricking does negate the fast. Do patients really check the blood glucose regularly the way it has been advocated? As exercise, do our patients perform Taraweeh? Do they change the timing, dose, frequency of medication, or do they just continue medication in the same way, the way they've been taking before Ramadan? And most importantly, do they actually have the suhoor meal, or do they sometimes have a late dinner? Do they sometimes miss suhoor meal? What exactly are our patients doing? At iftar, because as we all know, Ramadan is not only fasting, it is also feasting. Are our patients really partaking a lot of fried food, sharbat and sweets, which is actually what is believed and what is perpetuated? Or if our patients had the option, would they really consume with something which had less calories? Would it really be healthier meals at iftar? Is it that it is not available to them actually? Because as a society, we do consume a lot of high calorie food during iftar. So many questions and so many interesting answers. The mean age of the patients that we analyzed was around 49.6 years. Almost 54% of patients in this group of 3,190 participants were female. The highest education level in 60% was high school, followed by graduation and post-graduation in 25% and 14% respectively. What is very interesting, I do not know whether this was because of COVID or whether this is something which is there annually, but mind you, 40% of our patients said that they do not undergo medical evaluation before Ramadan. That is something which needs further attention. That means somewhere our patients have still not reached the point where they believe that medical evaluation before Ramadan is absolutely mandatory. A number of the patients, 87% patients, did say that yes, they did intend a medical evaluation after Ramadan, which is a contrast of kinds, because 40% said they did not undergo any kind of evaluation, but 87% said that they did intend to do a medical evaluation after Ramadan. 86.6% patients, mind you, reported fasting during even the Ramadan to 2020, which we all know did have a significant peak of COVID. And similar number did intend to fast or had fasted during Ramadan in 2021. So a significant number of patients continue fasting irrespective of other medical conditions or the pertaining situation. 65% patients reported that diabetes did not pose a medical challenge during fasting in last Ramadan. So they did not believe that diabetes had any issue as far as Ramadan was concerned, though there was a pandemic going on. Though, as we all know, as clinicians, we did tell our patients that, yes, you are exempt from fasting because of COVID, because we do not want to have any issue with control of sugars. Almost half our patients were on oral medications, but almost 28% were on both oral therapy and insulins. So that means a significant number of our patients who are also on insulin continue fasting. And most of these patients, as you know, the practice in our countries, were on pre-mixed insulins. Almost 55% of patients did have one comorbidity like hypertension, stroke, CKD, or CHD, but they continued to fast. What is a little worrying in this entire story, friends, is that 31% were not aware that Ramadan has an increased risk of hypoglycemia. 32% were not aware that Ramadan can predispose them to dehydration. Now that is worrying. That means we still, as a group, have a lot of work to do as far as patient education goes. 81% perceive that Ramadan did help them to control diabetes better. 77% were confident that they could control their blood sugar during Ramadan, be it from previous Ramadan experience or from the fact that they felt that the medications really were not going to hamper their control. And 78% were pretty confident that they could fast during the whole month of Ramadan. This tells you what your patients believe, what is their thought process as far as Ramadan goes. As I said, one of the biggest issues which we still have, that 40% believed that, 43% believe that if you prick your finger for glucose monitoring, it is going to break the fast. And this is in spite of all of us as clinicians all the time telling our patients that finger pricking does not negate the fast. We are increasingly seeing a problem even when we are doing CGMS of our patients, because a number of our patients do not like the sense of being attached during Ramadan, because again, they believe that it is going to break the fast. 40% of patients believe that diabetes medication is a barrier to fasting, and a number of them then do adjustments in their medication. Even now, in spite of all of us all the time saying that without monitoring, it is not an ideal situation to fast. You should monitor when you're planning to fast. What we need to understand is only 54% regularly monitor the blood glucose during non-fasting hours. So forget the fasting hours. Even during non-fasting hours, it is only 54% of patients who are actually monitoring their sugar levels. So we really do not know what kind of hyperglycemia we are seeing during Ramadan. We really do not know what kind of glycemic variability we are seeing during Ramadan. And we are not really sure what kind of fluctuations you actually see. So though we are advising our patients to monitor their sugars at varying point of times during the day and post iftar, it is not really happening in the real world. 75% of patients do practice Taraweeh regularly, including the female subjects, but in similar number do follow whatever medical advice is given regarding the timing of the medication, dose of the medication, or frequency of anti-diabetic medication. 15%, almost 16%, mind you friends, do not have suhoor. Most of the studies that we have done in our diabetic patients who are fasting during Ramadan have shown an increased risk of hypoglycemia if our patients do not have the suhoor meal. So we need to re-emphasize to our patients that the suhoor meal is a very, very important component of fasting with your diabetes, so that you are able to reduce the risk of hypoglycemia. I think that message still needs to go through. And though iftar is mainly calorie-dense food, which we believe our patients like to partake, you would be surprised. 83% said they would want to eat a healthier, mind you, less calorie-dense food at iftar. So that means we don't need to only educate our patients, we need to educate families, we need to basically practically educate society regarding the importance of having healthier, less calorie-dense food. So then we would be able to make a difference across the board regarding the feasting practice during Ramadan. If I close this, what I would like to say is that substantial number of patients do believe that fasting helps to control diabetes. We have miles to go as far as pre-Ramadan education is concerned, so that we can actually allay myths regarding hypoglycemia, side effects of medication, finger pricking, importance of a meal at suhoor. And I cannot say more than this, that pre-Ramadan medical evaluation again needs to be encouraged, because a number of our patients still do not undergo pre-Ramadan education and medical evaluation, but we need to emphasize it at all points of time, so that we are able to offer our patients a better, a healthier, a safer Ramadan experience, so that they can have a spiritually fulfilling month.